Can kids get hand, foot, and mouth disease more than once? Imagine catching a cold and thinking you're done with it forever. But then, a few months later, you get sick again. That's similar to what can happen with hand, foot, and mouth disease. This illness is caused by several different viruses in the enterovirus family. The most common ones are Coxsackie A16, enterovirus A71, and Coxsackie A6. When a child gets infected with one of these viruses, their body makes immunity to that specific virus. But it doesn't mean they are immune to the others. So, if a child recovers from hand, foot, and mouth disease caused by one virus, they can still get it again if they come into contact with a different virus that causes the same disease. Hand, foot, and mouth disease is very contagious and spreads easily among young children, especially in places like daycare centers and schools. It spreads through contact with saliva, nasal secretions, blister fluid, or feces of someone who is infected. The symptoms usually include a fever, sore throat, painful mouth sores, and a rash with blisters on the hands, feet, and sometimes other parts of the body. Most children recover within a week to 10 days, but the disease can come back if they encounter a different virus in the same family. Research shows that while not very common, recurrence of hand, foot, and mouth disease does happen. Studies suggest that about 2–4% of children might get it again within a few years after their first illness. These repeat infections can be caused by the same virus or a different one. Interestingly, the severity of symptoms in a second or even third infection is usually similar to the first, but it can sometimes be milder or more intense depending on the child's immune response. As children grow older, their immune systems become better at fighting these viruses, which often means fewer infections or milder symptoms over time. But because multiple viruses can cause hand, foot, and mouth disease, it's possible for kids to have it multiple times. That's why good hygiene practices like washing hands thoroughly and avoiding close contact with infected people are important to help prevent spreading the virus. In summary, yes, children can get hand, foot, and mouth disease more than once. The variety of viruses that cause it and the fact that immunity is specific to each virus means that a second or even third infection is possible. If a child shows symptoms again, it's best to consult a healthcare professional to confirm the diagnosis and get appropriate care. Most cases are mild and resolve on their own, but keeping an eye on symptoms and practicing good hygiene can help reduce the risk of repeated infections.